Recording.
Good morning, everybody. I am Rebecca Blanchard. I am our Senior Early Childhood Policy Advisor here with the Division of Child Development and Early Education. And I have the honor of working with the incredible Dr. Christy Snuggs, who is co-presenting with me this morning. And it is really our privilege to be able to connect with over 1,000 of you who are joining us this morning, this afternoon, technically now, to learn more about what's new in our Child Care Strong North Carolina Public Health Toolkit and what's going on with the Delta variant and with COVID in North Carolina. More than anything, we want to start out by saying thank you for taking the time to join us today, and wanted to remind everyone, hopefully folks can see my screen and see me moving slides, but we wanted to share that in order to receive credit for this webinar, for your time spent today, please make sure to enter your name, your child care facility, your email address, and your phone number into the chat box. We will also remind you again at the end of our session to do that. There are over 1,000 of you, so please do not forget to enter in that information into the chat if you want to receive credit. But let's come back to talking about each of you. Your work as child care providers, as leaders in our community, you are what make our child care system work. You are the system. You are the connectors, the lifeline for so many of North Carolina's families and young children. And we have all been working together. You have been working so hard throughout COVID since March of 2020 to operate your childcare centers and to stay up to date with what is happening as new information has come in and as our childcare toolkit has been updated. We want to take time this afternoon, to share an important update on what has been taking place with the Delta variant and what we are now seeing with COVID rates in North Carolina, and how that has led to changes with public health guidance in our Child Care Strong toolkit. And as we're walking through information this afternoon, we have the amazing Arletta Lambert from our team, who will be monitoring the chat as it's full of your contact information to get credit for the webinar. She'll also be monitoring the Q&A box for any questions that you have throughout our conversation this morning, and we'll have time dedicated at the end of our webinar to address themes of questions that we've seen come up. We also have Amy Peterson and Teresa Stenerson, who are available as well to answer one-off questions in the Q&A box that might have quick answers, and they're able to share links, and we are grateful for them as well, for their time and their energy this afternoon. Let's start by sharing information with each of you about what's happening with COVID in North Carolina and across the country right now. The Delta variant is something that you have likely been hearing about in the news, or you've been hearing about in your communities as a serious and concerning variation of the COVID-19 virus that is the dominant strain of COVID, as more and more individuals, not only in North Carolina, but across the country, are getting infected with COVID. What we're seeing is that the Delta variant is more transmissible than previous variations of the COVID virus. It is normal for a virus to mutate over time. This mutation, this variant of COVID-19 is more contagious than previous variants. I have heard that it is a similar type of contagiousness as the chickenpox virus was. It's very easy to transmit. There is also research that shows that the Delta variant may lead to more severe disease in individuals who become infected. However, we also know that COVID vaccines are still effective in preventing infection, and vaccines are especially effective at preventing severe disease, hospitalization, and death. And a couple more pieces of information that are recently coming up in research and in guidance changes is that if someone becomes infected with the Delta variant after they have been vaccinated, it's incredibly rare, then that individual may be able to transmit that infection as well as an unvaccinated individual. So there is some emerging information that even if you're vaccinated, you can transmit this virus. That is why the CDC has recently issued updated guidance that is recommending masks regardless of vaccine status in counties where there is substantial to high community spread of COVID, and that wearing masks indoors is a critical layer of prevention. And we'll come back to that as it relates directly to your childcare centers. But that's important to remember as you are a North Carolinian with your own families, that the Delta variant is real. And we're seeing this in our data right now. If you look on the far right of this graph, what you are seeing is the most up-to-date information that we have in North Carolina of our case rates of COVID broken down by age group. The yellow line are our children who are becoming infected with COVID. They're children under the age of 18. As you can see, prior to, let's say, about February to March, kids were the least likely to be infected with COVID in terms of rates of cases. But now, if you look at the far right, they are the third age group in terms of case rates. So our kids are becoming more infected with COVID. What we're seeing is this steep increase across age groups in terms of rates of COVID cases. And we all must pay attention to that, and we all have to do our part to prevent the spread. I'm seeing in the chat that maybe one or two individuals can't see the graph, and I just want to check with our amazing leader, Regina, just to make sure that I'm doing my part correctly and sharing my screen, and want to confirm that that's just a one-off.
You're correct. You're fine.
Okay.
I'm responding to some of these situations.
Thank you so much, Regina.
You're welcome.
What we're also seeing is not only is our COVID cases increasing right now across all age groups, but we are also seeing that case rates are increasing very steeply across all races and across ethnicities, Hispanic and non-Hispanic population. What we are also seeing is that our children are the highest percentage right now of our emergency department visits. That's concerning in terms of individuals who are coming in for reasons of a COVID-like illness. That could be respiratory symptoms, other types of symptoms that are COVID. And so as you can see in tracking that over time, we previously had not seen children being the dominant age group, and now we are seeing that. Another piece to keep in mind is that we know that children under the age of 12 are not yet eligible to receive a COVID vaccination. They have not been approved yet in that age group by our federal government, by the CDC. But even when we look at ages 12 and up, we see variation among these age groups of who is getting vaccinated, who is fully vaccinated in our state. So we're seeing that our youngest North Carolinians who are eligible for vaccine, they are about 1 in 4, about a quarter, a little bit more of our 12 to 17-year-olds are fully vaccinated. We're seeing about 35% of our 18 to 24-year-olds fully vaccinated. And it keeps going up. We do see really great news in our oldest, our most senior North Carolinians, who we know were at greatest risk for death and severe illness from COVID, are the most vaccinated. That's great. But what I hope everyone sees out of this graph and in the previous graph is that our youngest North Carolinians, those who are not vaccinated, and anyone across the state, regardless of age, who is unvaccinated, is at high risk for transmission, for getting sick from COVID, and that it must be our responsibility as leaders in our communities to take action to stop the spread of COVID-19. We can't wait. We have to vaccinate. We've seen, I've walked through these talking points on the previous graph, previous couple of graphs at the beginning in these first bullets, and we'll talk more about them. But I want to highlight that Governor Cooper he did not reissue our required mask mandate across the state that expired July 30th. And instead, in our revisions to the Child Care Toolkit that Christy will share much more about, we are depending on and looking to our local community leaders based on transmission rates locally, based on what research shows us, to take action and to emphasize masking and vaccinations as the way to stop the spread of COVID-19. And it is more critical now than ever that anybody who can get vaccinated does, anyone over the age of 12, to stop the spread, because our youngest children cannot get vaccinated. And we see a quote here at the bottom from Secretary Cohen that is, I think, clear as day. Get vaccinated right now if you haven't. We are seeing the impact of the very contagious Delta variant of COVID-19, and it's hitting those who are unvaccinated hard. With that in mind, I am going to pass this presentation over to the incredible Christy Snuggs, who's going to share more about how DHHS has taken this information on the Delta variant and has taken federal guidance and incorporated all of this into the most recent updates to the Child Care Toolkit. Christy, handing it over to you.
Thank you, Becky. Good afternoon, everyone. So glad to be with you and to have such a great turnout. I will just say that we did not realize how many folks were going to join. So we are at our 1,000 person limit. So we apologize for anyone who might be having trouble getting in with this. If we need to do another round or another webinar, that is something that we can think about looking into for next week. So if there are folks, we will definitely address that, but just wanted to let you know that if you're having trouble, that may be the reason. Guys, so thankful to have you on the call today and the webinar. Want to do similar thing that Becky did, and thank you all for the work that you have done, the tremendous work you have done over the last 18 months. We could not have done it without you. You are the front line. Just as of right now, we're almost back up to 85% back enrollment in our classrooms. understand that that's because of the tremendous work that you've done to look for teachers. We know that there's an issue with that across the state right now. And while I can't solve that today, I promise you that is in every conversation that we're having and in every thing that we do. We are thinking about our providers and how we can provide you relief and help you with the enormous challenges that you're facing. And as one of those is this Delta variant that Becky has just been talking about. All of the facts and the statistics that she's given, that it's actually impacting us so much harder than some of the other variants, and especially our youngest children, because they cannot be vaccinated at this time. So what we're going to do is to talk just a little bit today about the changes to the toolkit. Hopefully all of you have gone onto the website and downloaded this most updated version. It is different considerably than previous versions. So if you haven't looked at it, please go out there. We send out communication with links to it, but please go to the website and download it because it is one that you really need to look at. As we begin to think about and to align this document as we have throughout the pandemic, we've aligned with the federal guidance from the Centers for Disease Control and also relied on our health experts in the state. And I have to say, you know, North Carolina is heralded as a leader in how we have addressed and dealt with the impact of COVID-19. And our childcare arena is also looked at highly because we kept our childcare facilities open. And while we have had clusters at many of our sites, it has been a low number in comparison to the rest of the United States. And that is because of the great work that you guys have done and the health and safety standards and all of the extra health and safety standards that you employed over the last year to keep the children, your staff, and the families that you serve safe from this vaccine. That's what we want, from this virus. So as you will see, as you've looked at or maybe read, and I just hit the button too fast, sorry, let me go back. The new guidance, what we're doing, and Becky mentioned this, is we're really trying to prioritize the implementation of strategies that are most effective in lowering the risk of the COVID-19 exposure and the spread in childcare settings. So let me be perfectly clear. Becky has already said that the governor's, the expiring of the executive order on July 30th got rid of the mask mandate for North Carolina as far as what needs to happen in our childcare facilities. And I'm sure that as you have looked and watched the news recently, you've heard of all the school systems that are locally determining what they're going to do, whether or not they're going to require masking or whether or not it was going to be left up to individuals. That is the exact same thing that is now available in our childcare facilities. There is no longer a statewide mask mandate for your teachers to be masked, for the children to be masked, for parents to be masked. That is no longer a state requirement. However, that does not mean that it is still not a best practice. That does not mean that it is not highly recommended from our health professionals, from the Centers for Disease Control. And that's why I'm saying to you that in this new guidance, we are prioritizing the implementation of the strategies that we think will be most effective at preventing the spread and lowering the risk of exposure to COVID. So things like monitoring for symptoms, the temperature screenings that you've been doing, they're no longer required. And that, of course, aligns with CDC, and that frees up some of your staff for other responsibilities. But based on the data that was just presented to you and the number of children that you serve and the families and the population that is most susceptible right now because they do not have the option to get the vaccine, it is still highly recommended that you not change your practices. Guys, you've been doing this for 18 months. You've been doing it right. You know how to prevent the spread of this illness to the best of your ability. You've been doing that. You've been keeping our children and your staff and your families safe. It is not childcare that is making this spread. As Becky has said, it is people that have the opportunity to be vaccinated that have not been. That people that aren't vaccinated are wearing their masks because this new variant, excuse me, is more contagious. Normally, if someone is exposed in the earlier strands of the virus, they would pass that along to maybe 2 people. This one we are seeing can be passed on to 6 to 8 or more people. So even though the guidance is now really providing you the opportunity to make some educated decisions, I would highly recommend that you follow through with the techniques and the strategies and the practices that you've been implementing that have kept your centers safe. So, with that being said, we know that you are working with parents who have concerns. We know that you have concerns yourself. Everybody's tired of wearing the mask. It's costing you extra money. I understand all of those pieces, and we're trying to provide for you the supports you need to continue to do what is right. So as you look at the new guidance, it's really now organized into 3 categories. It is no longer saying this is required, this is recommended, the way that you've been accustomed to. There's still those parts, but what you'll notice as you skim through it is that there are very, very few requirements, things that are required. But it is still divided that way. In the first category, there are still strategies that are required. But these strategies are things that are based on existing laws and child care rule. So, for example, if you, before COVID ever came about, if you had a child that had a temperature or that was lethargic or was not participating as they normally would have, you would isolate and exclude those children from the other children. That's in child care rule based on what you've always done. Those things are still required. You still have to do your health checks on a daily basis. Health checks meaning you talk to the parent. How was last night? What is going on? You still do those. I would recommend you still do the temperature checks because that's how you catch it. A lot of times parents don't even recognize that their child may have a temperature until they start acting differently. Hand washing. You have to still do that. That's required by our sanitation rules and by child care regulations. Hand washing is a key to preventing the spread of contagious viruses and diseases. So anything that is in law or in child care rule, those are the things that you will now see identified as required in the new health guidance. But there's a second category, and this is the category of strategies that should be implemented. And the language is different. It says should be. Should does not imply must, that it's required that you have to do it. But these are strategies, if they're not implemented, will create conditions for much more risk of the COVID-19 virus being spread. So what we've done is we have placed the onus on you as childcare providers to create your own rules and policies related to how stringent you want to be. You are the ones that can determine if this is something that works for you. These are the strategies that should be implemented. Our health professionals on the line will probably I know, not probably, will endorse and back me up that you should be doing these things. These are the types of things that will reduce the risk. And what kind of things am I talking about? Having your teachers to wear masks, I would recommend highly. The reason for that is they, as Becky shared earlier, can be vaccinated, but if they are exposed to this virus, can still spread the virus. And they are taking care of children who can't be vaccinated. This virus is more highly contagious. So if they happen to come in contact or exposed to it, they could pass that along. So by masking your teachers, you are protecting the children, but you're also protecting them if a child has been exposed and come in. So things like masking, temperature checks that you were doing. This is a way to, again, identify a child who may, or any person that's coming into your center who may be coming down or being exposed or have one of the symptoms of COVID. Another recommendation are things like cohorting of your students. We've talked about this. We know that this is very difficult in a time where it's very hard to find staff. But if you can keep the same group of children together with the same teacher and not have different people coming in and out of the room, that is what we mean. That's really social distancing in childcare. We can't set a 2-year-old on one side of the room and tell them they have to stay 6 feet apart from another one. We can try activities to keep them apart, but we cannot keep 2-year-olds from going and looking and touching and playing with one another. But by keeping the same group of children together with the same teacher each day, that is a form of cohorting that does not allow for unnecessary exposures from different people coming into the facility. So things that you see in the toolkit that are recommended or highly recommended are things that we would encourage you to still enforce in your centers or your homes. And then lastly, the third category are strategies that childcare leaders could consider adopting. These are strategies that really provide additional layers of prevention, and it helps you to further reduce the risk of exposure or spread. And so things that we're talking about there would be things like staggering when children come to the facility, like you did early on in the pandemic, different drop-off times, allowing only one family member, the same one or one at a time, to come in and pick up the children or drop them off. Maybe even going the extra step, not just to screen the children or visitors into your center, but also screen your staff to make sure that they're not bringing a COVID risk into your center. So this is what you'll see as you look at the new guidance. It's broken down into these 3 categories. There will be very limited requirements, but there are still many, many strategies in categories 2 and 3 that we would encourage you to continue to implement to cut down on the spread and the exposure of COVID-19. So I love this slide and I love this illustration. All of you, I'm sure, are familiar with Swiss cheese. And if you're like me, cheese is one of my dream to go-to snacks or thing. I have to have cheese on everything. But Swiss cheese, as you all know, have holes. But every slice has a different array of holes and how they're designed. And so if I'm making a sandwich, one slice of cheese is not enough. So if I put one slice of cheese on my sandwich and I use Swiss cheese, there are still holes where things can get through, that virus can get through. So if you think about the first slice of cheese as being the mask that the teachers and the children and the staff and others that are coming into the center are wearing, that's going to prevent a large amount of stuff coming through because there's only those little holes that it can get through. But if I add a second slice of cheese on my sandwich, it makes it a lot more tastier, But if I think about that in the form of additional layers of protection, if I lay a second layer of protection, there's going to be fewer holes for the virus to escape through. So this you could think of as physical distancing, but in childcare, the cohorts that we spoke to just a moment ago. And if you add a third slice of cheese, again, this is just getting better and better, that's your cleaning and disinfecting that you're already doing because it's required by childcare rule. And then you add a fourth slice, and now, I don't know, that's getting a really thick sandwich there. But you add that fourth slice of cheese, and those are the hand washing techniques that you're already giving. And then if your staff are vaccinated and your families are vaccinated, then what happens by adding all those layers is that you get to a point that there's a very small likelihood that we can transmit and spread the virus. But if I take all those slices of cheese off my sandwich and go back to that one, it's not going to be near as tasty. And just like if I remove all of those layers of protection and only go back to wearing the mask or not wearing mask at all, then that's going to be much more likely that I could spread this variant of this virus to children, to staff members, and to my families. No layer is perfect. One layer can't prevent 100% of COVID spread. But if we combine them and do all of these different things that you've been doing, then we can significantly reduce the spread of the COVID-19 virus. So that is what I want to say, but now I'm going to bring on the real superstar of today's presentation, and that is one of your fellow colleagues, a childcare provider who has been living this just like you all have over the last however many months it's been. I have the distinct pleasure this afternoon of introducing you to our guest speaker, Ms. Davina Bolden Woods. She is the owner and operator of Genesis Child Development Center. This is a new educational facility located in Burlington, North Carolina. And she has over 15 years, for over 15 years, she has served as the Chief Education and Enrichment Officer for Excel Christian Academy, which is a 5-star preschool and an NC Pre-K Academy. She has been vital in implementing various early education organizations' work, mission, and vision during her 28-year tenure in the profession. She also daily works to develop and coordinate and advocate for students and families and childcare practitioners across the state. She is passionate. I met her the other day and talked to her, and she is so passionate about the work she does. She's passionate about promoting high quality early learning environments and supporting practices that are family centered, but she's also passionate about advancing the field of early childhood and education. She began a career as an educational professional in 1993, and she continues to advocate for equitable access to high quality educational experience for all children, all young minds. She's a graduate of the University of North Carolina at Greensboro, North Carolina A&T, State University, and Alamance Community College. She possesses degrees in early childhood leadership and program administration, child development and family studies, and early education. She's passionate about education. She has been appointed to numerous committees. She served on our Child Care Commission. She was appointed by the former Governor Mike Easley. And she has done so many things. She serves on many national boards. She was born in Pittsfield, Massachusetts. We are so glad she's now in North Carolina. She's married to a reverend. I'm sure she keeps him straight as well. And she has two wonderful children, Chris Jr. and Sierra. And she's here today to share a little bit about her experience. So without further ado, Davina, it is all yours, lady. And I'm gonna show you a picture of her. So, and her beautiful self, and let her speak to you. Thank you, Davina, for being with us.
My goodness, Christy. Guys, y'all really make me sound like I've done something with my life in this field. Thank you guys so much. I cannot tell you what an honor it is to be before all of you this afternoon and just given the opportunity to do what it is I love to do and speak to the early care and education practitioners, those that are working in the trenches and those of us that are out here doing the work, building brains. So I'm going to try to stay within my time frame and stick to the script. So great day, everyone. Wow, I know that a lot of information has been given to us, not only today, but we've received quite a bit over the past 18 months. Indeed, I know that we have been inundated with facts and figures, guidance and guidelines, and it seems that the wheel is ever turning. Sometimes it indeed can be information overload, and I'm certain that many of us are COVID fatigued at this time. And I apologize, I did not take my text messages off. And to all of my wonderful friends that are with us in this thousand, I love you all. Thank you guys so much for the support. But indeed, who would have thought that a year and a half later, this would still be at the forefront of our daily discussion? Wow. But here we are. We headed into extra innings. We are in overtime, and guess what? There's still more work to be done. So I tell you, take a moment, take a breath with me. Just inhale and exhale, be present in this moment, and realize that despite everything, we are still here. We are still standing. We are still strong. And we remain essential as we were even before a pandemic. So kudos to you for persevering and doing so with exceeding excellence. So as Christy said, my name is Davina Bolden Woods. I am indeed a local child care provider here in Alamance County. And like many of you, I have been directly impacted by coronavirus, both professionally and personally. I tested positive for the virus a little over a year, not even quite a year ago. And even as a healthy individual with no pre-existing conditions, I found myself at the mercy of this virus. Although I work out at least 5 times a week, and I have consumed a healthy diet for over 5 years, for 28 days, COVID wrecked my body. It filled my lungs with fluid, and it exhausted every bit of energy I could even think to muster. Couple that with the fact that over a span of 6 months, I laid to rest 5 of my family members. First, it was my grandfather, then my aunt, and within 2 weeks of each other, I lost my grandmother and 2 of my uncles. So to say that COVID sucks, yeah, that truly is an understatement. So let's be clear, I am certainly a pro-vaxxer, and I thank all of you who have chosen to be vaccinated. But hear me when I say that if you indeed have educated yourself with reliable and factual information and have made the personal decision that vaccination is not for you, I respect your decision. I ask that each of us remain vigilant in our Vax Up, Mask Up advocacy and ensuring that we establish those layers of protection and prevention between COVID and our kids. That our children do not have the option to choose vaccination. So therefore, that's in our wheelhouse now. That's our job. So as an early education practitioner, you are a trusted source. You are a trusted source for your families. They have indeed entrusted you with their most precious gift, the most significant thing that most will ever embrace, and the most important work that indeed we will ever do. Of course, they look to you for guidance and leadership for not only their children, but for their families as a whole. Therefore, it is important that you educate yourselves so that you are able to assist parents with reliable information regarding vaccination. And I urge you, if you do not have the answers and are blessed, as we are here in Alamance County, with a phenomenal healthcare consultant, I urge you to leverage them as a resource. Now I know that we are at the parent's discretion, especially in this time, as to whether they share very important information with our programs that will assist us in ensuring that we continue to provide safe and healthy environments for all of our students and staff. It is up to them whether they advise us if anyone in their household has been exposed, if anyone has indeed tested positive. What I say to you guys is that it's imperative that we reestablish those essential lines of communication. Now, I know that in our efforts to prevent the spread of the virus, we indeed kept families kind of at bay. We were stopping them at the door, sometimes meeting them in the parking lot, doing temperature screenings, right at the front of the building, and kind of preventing them from coming into the classroom area. And if indeed you are still utilizing those best practices, kudos to you. What I encourage us to do is that we need to be very creative and very innovative in our methods of communicating with our families. So whether you utilize a parent app such as Class Dojo, or you use a private social media page, or create a space within your program where you can have a masked and socially distanced face-to-face conversation, the options are endless. However, the need, it is essential, because the communication and the relationships that we have established along the way, that is what we want to remain. That is what we want to be in place even once this is a distant memory. Now, I want you to take a look around at all of these attendees. As Christy said, we maxed out at 1,000 today. So we see that there are many of us out there. However, each program is indeed unique. Everyone services their families in different ways. And guess what? No one, absolutely no one, can do it quite like you. You are the only one that knows the idiosyncrasies of your children and your families. Who else would know that Sarah needs a blessing bag on the weekend? You know, that bag you send home ever so discreetly, that's filled with food and snacks that make sure the kids have something to eat until they can get back to you on Monday? Or who would know to have a set of clothes ready for Sam on any given day, because he's going to need to be cleaned up after having a wedding accident at night, but showing up to your doorstep with that unattended? See, these are the things that we do that no one else knows. We have to remember our why it is that we chose the early child care profession, why it is we began this journey in the first place, and keep that in the forefront of our memory each and every time a new toolkit is released. Yeah, because it's not about the toolkit, it's not about the guidance, it's about the children and ensuring that they have a strong foundation, so indeed they can have a brighter future. So hear me when I say that I believe in you. Guys, I'm rooting for you, and I'm sending nothing but positive energy in your direction. I hope indeed that you do something absolutely amazing and beautiful for yourself this weekend to celebrate the small victories. 18 months, guys, you're still here. Head is still above water. You're still sane. We haven't sunk, we haven't drowned. And we're doing this and doing it well. You have won yet another day. Indeed, it's Friday. We've conquered another week. It's the beginning of August. We've embarked on a new month. I want you to recharge your batteries so that you can show up on Monday morning with a renewed spirit. Because guess what? There's still work to do, and it needs to be done by you and you alone. I want you to reflect and assess, because we have to educate ourselves, our children, and our families. We must encourage people to vaccinate, because the vaccination status, it can directly affect your life and your livelihood. And we must find more effective ways to communicate, because we remain connected even when standing 6 feet apart. Hey guys, if not you, then who? Thank you guys so much for the moment. I pray that the balance of your day is abundantly blessed. I love you, and I'm praying for you.
Davina, thank you so, so, so much. Wow, what a tremendous role model and leader. And we just can't thank you enough for being with us today and empowering us with such an insightful message. Thank you so much for your words and for sharing with us today. Guys, we're running short on time. I want to move forward. Next steps. Ways that you can keep leading in your center in your community. We, as Davina just said, she did it eloquently. Childcare providers, you are leaders. You are trusted members of your community that people respect and listen to. You take care of their most prized possessions. We need you to help us promote vaccines and regular testing in communities. Share the message to vax up or mask up. Tell them, don't wait, get your vaccines. Even though the $100 cards have run out, we're getting more, okay? It's the right thing to do. But also, you are the people that have the relationships with the families. Discuss your changes with them. Tell them why you are protecting their livelihoods. This is the reason you have put these different strategies in place to protect the children, to protect the families, to protect yourself. You are also, though, no one is telling you you can't be innovative. We're giving you the opportunity to do innovative things. You need the families to be part of this with you. Let them help you. Together, we will get through this next round. Remember, you're a leader for your center, for your local community. You need to decide what health policies you're going to implement. Your families will follow if you keep them in the loop as you are going through it. They need to understand. They need to be part of the decisions. Suggest policies that says the child care facility is, I suggest you use policies that say things like, our child care facility is following the health toolkit that our health experts and the CDC has endorsed. And we will update it as the toolkit is updated. And then you don't have to rewrite policies every month or every week or every day as things change. If you set the policy and the time frame and you explain to your families why, then you can make this work. Emphasize the helpfulness of things like daily health checks. This is a time for you to have that communication. Warm, fuzzy handoff of their children. Make sure that they understand. And it's also a time for you to learn more about what's going on with their families. Thank you for leading through this last 18 months. Thank you for your perseverance. Thank you for the work that you're continuing to do. And thank you for being the cornerstone and the backbone of North Carolina's economy. We appreciate you. We thank you for the work you have done and are continuing to do. And we are ready to be there with you to move forward. We're going to get through this. Thank you for attending today. We want to open it up now for questions. We are running short on time. We have about 10 minutes to get through a couple. So I'm going to turn it over to Arletta, and our wonderful panelists will do our best to answer your questions.
Yes, thanks, Christy. First up, we got a question about how they are able to tell which variation of COVID the person is testing positive for. And I believe, Becky, you have that answer.
Yeah, sure. Thank you so much, Arletta, for capturing the great questions that our over 1,000 attendees have. We are basically a certain proportion of COVID tests and samples of tests are run for a particular screening at the state level to find out what type of variant, what type of strain of COVID that they are. And most likely someone who is getting infected with COVID today has the Delta variant. It's over 80%, I believe it's 83% of all COVID cases right now in North Carolina, and similar rates throughout the country. Those sequencing tests are done at the state level regularly for a sub sample of samples. So regardless, if you have COVID, you need to go immediately isolate yourself at home. If you are feeling any kind of symptoms at all, we want to prevent the spread of COVID, regardless of what variant you have. Masking and vaccinating are the key tools that we have in our layers of prevention, those Swiss cheese layers that Christy was talking about. And we need each of you as leaders in your local communities to emphasize wearing masks and getting vaccinated, regardless of whether you have the Delta variant or not.
Thanks, Becky. A second question we got sort of frequently was about the information regarding the weekly COVID testing of unvaccinated staff and how childcare providers should consider implementing that. Becky, what are your thoughts on that?
Yeah, I'm happy to take that one. And I will say that it's important that we continue to learn from each of you and learn from what is working in your center or in your home, in terms of what's working operationally, how you're communicating with staff. But generally, if we can drop this in the chat somewhere, if you visit Find My Testing Place, or Google the words Find My Testing Place, NCDHHS has multiple different options for ways to find access to free COVID testing all across the state. Those can be at community testing events, or those could be through a local pharmacy. Those could be at-home testing kits, or you could get tested through many primary healthcare providers. There are a variety of different ways that a childcare program could require weekly testing of their unvaccinated staff if that were a chosen prevention method by a leader. We would be happy to support operationally what that might look like, whether that means your child care center would partner with a local provider and send staff who are unvaccinated every week to get a COVID test. We're happy to provide that support. But I'll drop the link in for the Find My Testing Place resource in the chat if we haven't already.
And
Christy,
Becky,
do you have other thoughts?
if I may add to that, remember when we first started the push for vaccines and so forth, we also worked with our partners in our local communities, like our child care resource and referral agencies. Please use them as a resource, or your Smart Start partnerships. They have information about where these testing sites are and vaccination sites are to help spread that information. And then I would just encourage you also to think about staffing and a plan of how you would work that in so that you have your coverage in your facilities of when they can do it. But there is testing available in every community at various times, even before and after your operational hours, or even on the weekends.
Great. Thanks, Christy. One other question that we got, and this might be the last one that we have time for. We've gotten a lot of questions around the masking. And so, Christy, would you mind covering that language around masking one more time to close us out?
Sure. So thank you for that question. Masking is no longer required of any of our child care providers or children because the mask mandate is no longer there. In the previous health guidance, the teachers or your staff were required to wear masks. That is no longer there. However, it is still highly encouraged, and I would encourage your staff to wear those for the reasons that we have talked about throughout this webinar. Now, the recommendation that children, that's the one that I saw coming up, wear masks from 2 and above. And then I saw emails or chats about people saying a 2-year-old can't keep their mask on. Yes, I get that. that is why you have to make sure you have to do what makes sense developmentally with the children and also reasonably. If 2-year-olds are not able to keep their mask on and wear them properly, and what we mean by that is that they can put them on and take them off at the appropriate times, then it is probably not of your best interest to try and keep them masked, because sometimes if they take those off, lay them down, if they have something on them and another kid puts it on, you have to make those determinations. But if you go into a classroom of 4-year-olds who are going to start kindergarten, or there may already be 5 and are going to start kindergarten, or you have school-age children, they are very accustomed to wearing masks in other settings, and they could easily wear their mask in an appropriate way. So the masking of children is a difficult one. That recommendation has been in the guidance throughout, that children 2 and above wear masks, but you have made those determinations throughout the last 18 months of what makes sense. And I would encourage you to continue to do what you've been doing in relation to that.
Great. You did that so succinctly, Christy.
Right on time too.
I know, right? Just one reminder before we close, and Christy, I'll turn it back over to you and Becky to close. Just one more reminder that the latest version of the toolkit is dated August 2nd. So just a few days ago. Please make sure that you are reviewing and using that version of the toolkit for the latest, most up-to-date information. And with that, Christy and Becky, I'll turn it over to you to close us.
All right, guys, I want to just speak up and say thank you again for joining us. We are amazed at the number of people. We know that this was an important issue, and it may be that we need to do a follow-up, and we will look into that. But thank you for your time. Thank you for the work that you're doing. And please help us to remind people that not to wait to vaccinate. That is the best way for us to prevent the continuing spread of this virus. Becky, any last words?
No, thank you so much. And I echo what Christy just shared. Christy, can you click on the next slide for us?
I can.
Thank you, ma'am. Just a reminder, don't forget, we've seen folks entering in their contact information to receive credit for this webinar. And we know that a number of people weren't able to log on. It's our understanding that this webinar has been recorded, and we will be able to share it, distribute it widely. If for some reason that we're not able to do that, Christy and I love to talk, and we would love to do this again. And would be happy to do so. Can you click on our last slide for us, Christy? If we can be helpful, if you want to contact us about anything, our inboxes are always open, very full, but we are here for each of you, and we are grateful for your leadership during this time of spread of COVID, and we need each of you to continue leading. Thank you.
And Becky, I would just add, I saw a couple of comments of people asking me things. If you will just follow up with an email to me, that would be great. We will get the chat, but information out of the chat, but you might get a quicker turnaround if you'll email me your questions. Thanks so much.
Thanks, everybody.
Have a great weekend.